When was the last time you actually thought about taking care of your penis? And no, I'm not talking about worrying about its size or thinking about what it can or can't do in the bedroom. I mean real, proper care, like you would for your teeth, your heart, or your skin. I'm Dr. Annabel, and today we want to talk about how to take care of our penis even after 60. Before we dive in, kindly subscribe, like, and share, because you are about to get enlightened by this. Many men believe that once they cross the age of 60, their days of intimacy, desire, and sexual confidence are over. They think weaker erections, lower drive, or even complete disinterest are just part of aging. But let me tell you something clearly. That belief is one of the greatest myths of manhood. Aging does bring changes, yes, but decline is not inevitable. Your penis can remain healthy, functional, and capable of pleasure well into your 70s and even 80s if you learn how to take care of it. I've seen this firsthand. Years ago, a patient in his early 60s came to me feeling frustrated. He said, "Doc, I guess this is it. My sex life is over." He hadn't had a firm erection in months, his confidence was gone, and he stopped being into his wife because he was ashamed. But after a few months of lifestyle changes, simple things like walking every day, cutting back on alcohol, and doing pelvic floor exercises, he came back a new man. His words still stick with me. "I feel 20 years younger, and I thought this part of my life was finished." The truth is, it wasn't finished. It just needed attention. So how do you actually care for your penis after 60? Let's start with the most basic step, hygiene. As the skin gets thinner and drier with age, proper cleaning becomes even more important. A quick rinse in the shower with warm water each day, gently pulling back the foreskin if you have one, is enough to prevent infections that can sneak up more easily in older age. Avoid harsh soaps. They strip natural oils and leave you irritated. And always pat dry. A lot of older men skip this step, leaving moisture trapped, and then wonder why they're dealing with itching or redness later on. One man told me he thought he had developed an allergy when in reality it was just fungal overgrowth from not drying properly. Once he started taking a few extra seconds with a towel, the problem disappeared. Sometimes the small things make the biggest difference, but hygiene is only the foundation. After 60, the real key is circulation. Erections are a blood flow event, nothing more and nothing less. The penis is like a balloon. Without strong circulation, it won't inflate fully. And here's the important part. The blood vessels in your penis are some of the smallest in your body, which means they're the first to show damage from high blood pressure, diabetes, or cholesterol. Many men discover their heart disease or diabetes only after struggling with erections. In a way, your penis is the canary in the coal mine. It signals when your circulation is struggling long before a heart attack ever does. Let me share another example. A man in his late 60s came in complaining about erectile difficulties. He was embarrassed, but I asked about his medical history. He shrugged it off, saying he was healthy enough. But his blood pressure was sky high, and his cholesterol was through the roof. He'd ignored doctor visits for years. The erectile problems brought him in, but addressing those issues actually saved him from a much bigger health crisis. Within a year of changing his lifestyle and getting treatment, his circulation improved, his energy came back, and yes, so did his erections. That's how closely penis health is tied to overall health. Exercise is the best medicine here. Even a daily 30-minute walk strengthens blood vessels and keeps circulation flowing. Cycling, swimming, or light strength training also work wonders. Smoking, however, is the enemy. Nicotine strangles blood vessels, and no matter what else you do, if you keep smoking, erections will always suffer. Alcohol should also be limited. A glass now and then may relax you, but regular heavy drinking numbs the nervous system and weakens circulation. Now let's talk about something men rarely think about, the pelvic floor. These are the muscles at the base of your pelvis, and they're critical for sexual health. They help trap blood in the penis during an erection and give you control over ejaculation. But like any muscle, they weaken with age, unless you train them. The good news? Training is simple. Just tighten the same muscles you'd use to stop your urine mid-flow. Hold for a few seconds, then relax. Repeat throughout the day. One man, 72 years old, came to me worried he was losing control. His erections were weaker, and he sometimes leaked urine when coughing. He started daily pelvic floor exercises. Within 3 months, his control returned, and his confidence skyrocketed. He told me with a grin, "I never thought clenching invisible muscles would save my sex life." It did. Never underestimate the power of strengthening your foundation. Diet also matters more than ever after 60. Your body doesn't process food the way it used to. Every nutrient counts. Zinc is essential for testosterone and sperm health, even if fertility isn't your concern. Foods like pumpkin seeds, shellfish, and beef are rich in zinc. Amino acids like L-arginine and citrulline, found in nuts, beans, and watermelon, help produce nitric oxide, a natural chemical that relaxes blood vessels and supports erections. Omega-3 fatty acids from salmon or flax seeds keep blood vessels elastic. And don't forget vitamin D. Many older men are deficient, and that deficiency lowers both mood and testosterone. A little sunlight or supplementation can make a huge difference. And water. Simple hydration improves energy and circulation. Many men mistake fatigue or weaker erections for age, when in reality, they're simply dehydrated. I once knew a retired teacher, 65 years old, who felt his sex life slipping away. He lived on fast food and coffee. When he changed his diet, more vegetables, healthy fats, and zinc-rich foods, his energy returned within weeks. He said, "I thought I needed a miracle pill, but all I needed was to eat like I cared about myself again." That's the truth. Every bite you eat is either fueling or draining your sexual health. Of course, supplements can play a role. Ginseng, maca, or citrulline have shown benefits for some men, but they're not magic. They work best when paired with a healthy lifestyle. The most powerful supplement, I tell men, is consistency. Consistency in exercise, diet, and self-care. Now let's be direct. Safe sex still matters after 60. Many men re-enter relationships after divorce or loss, and they assume STIs are a young person's problem. They are not. In fact, rates of sexually transmitted infections are rising in older adults, often because men think condoms are unnecessary after fertility is no longer a concern. But infections like chlamydia, gonorrhea, or herpes don't care how old you are. Protect yourself and your partner. Responsibility doesn't retire. Mental health is another layer of penis health after 60. Stress, depression, and anxiety are some of the biggest erection killers. And performance anxiety, worrying about whether you can perform, often makes the problem worse. Many men compare themselves to their younger selves and feel inadequate. But here's the truth. Intimacy at this stage of life is richer, deeper, and often more satisfying because it's about connection, not just performance. Confidence, communication, and presence matter far more than lasting for hours or trying to act 25 again. And don't forget sleep. Even 1 week of poor sleep can drop testosterone by 15%. Good rest isn't a luxury. It's medicine. There are also warning signs you should never ignore. If erections are painful, if the penis starts to bend significantly, if there are lumps, sores, or unusual discharge, see a doctor. Early detection matters. A man in his late 60s once ignored a growing curve in his penis, thinking it was nothing. By the time he sought help, he had developed Peyronie's disease, a condition that can cause painful curvature. With earlier treatment, his outcome could have been much better. Don't wait. And finally, let's talk about aging. Yes, things change after 60. Erections may take longer, recovery may be slower, testosterone may decline. But decline is not the end. I know men in their 70s and even 80s who enjoy a vibrant sex life because they took care of themselves. They exercised, they ate well, they managed stress, and they stayed curious and connected with their partners. I remember one gentleman, 79 years old, who told me, "I'm not chasing youth, I'm chasing life, and my wife and I are living it fully." That's the mindset. You don't need to be 20 again. You need to be the best version of yourself today. So here's the truth. Taking care of your penis after 60 is not just about sex. It's about protecting your health, your confidence, your relationships, and your joy in life. Hygiene, circulation, exercise, nutrition, pelvic floor strength, safe sex, mental well-being, they all connect. Ignore them, and decline is certain. Embrace them, and vitality is possible. Gentlemen, your age does not define your potential. With the right care, your penis can remain healthy, functional, and full of life, even after 60. And in caring for it, you're not just protecting your sexuality, you're protecting your overall health and happiness. I'm Dr. Annabel. Subscribe for more powerful tips on aging with vitality.